Maria, do you have anything to add to this question?
Well, I'm just thinking on a practical standpoint. I have a husband and 2 kids, and I have a little one who's 2 years old who's in creche, and little kids get sick a lot. And you just think of, they come home and there's a lot of germs that circulate around. And I'm particularly thinking about this because in many countries right now, schools are starting to open again. And this is absolutely wonderful. In countries where transmission is being brought under control, kids are going back to school, and there are many safe ways that kids can go back to school and making that environment as safe as possible. And that's really wonderful. So that's good. But when kids mix, there's a lot of germs, not necessarily COVID-19, but there are other respiratory pathogens that circulate around. And I think in my own family, what do? We take a precautionary approach in this situation. I asked viewers a few months ago to make a plan. So if you need a test, what do you do? In the area where you live, how would you get a test? Who do you need to report to? How do you make that appointment? And for us, what we do, my husband and I, if one of us is feeling unwell, first thing we do is actually alert our staff wellness here and just say, I'm just feeling, not feeling so great today. Here's my signs and symptoms, my age, my underlying conditions, if any. We just kind of give and say, we'd like to get a test. And that is supported from here. We make an appointment, we go get the test. And it's better to be safe than sorry. Because in most situations, there are other things that are circulating depending on where you live. It may not be COVID, it may be COVID, but you need to know. And in many countries, there are systems set up that you could book an appointment and get a test. Some have drive-through centers that you can do this. And in some countries, there's home tests that you could use, as long as those are approved by the right agencies to approve that they are well-functioning tests. And it's good to know. If you are feeling unwell in general, you should stay home. If you can stay home and contact your medical provider. Because if you are unwell, you need to report what that is to someone. In areas where you have fever and dengue is circulating or malaria is circulating, we want to make sure that you're also contacting a health provider if you can to ensure that you get the right type of care. And then get a test. Stay home if you can. Stay home from work. Isolate until you get your test results. And make sure that you list your contacts and inform your contacts. But it's all about the practical actions that each one of us can take. And right now, if you're watching, if you don't know how to get a test, find out. If you don't know what the steps are where you live, find out what that is. What are your options? Because we're 14 months into a pandemic. Testing has increased substantially around the world. There still are some gaps in terms of the abilities to get tests, but find out what it means for you so that you know what the next steps are and make a plan. And if you, like my husband and I, we don't have grandparents that live down the street and, we need a plan for our kids as well. Just think through those types of things, especially when you have a calm moment. I'm not sure anyone has calm moments anymore, but think through what you might need to do, and that'll help. Write it down so that you know exactly what you can and cannot do should you need a test.
Yeah, I think, Alex, we were talking about vaccination. If we're expanding vaccination and we need to accelerate, we also need to expand testing and the availability of testing and rapid testing at the same time. All of these things will help us to isolate this virus where it should be, away from humans, and do that. I've come out of a meeting today on therapeutics, on drugs. We're still doing a huge amount of drug discovery and running with partners and many around the world doing huge amounts of work on developing new therapeutics. And we know the value that those, when you arrive in hospital, test doesn't make you better. Even a vaccine doesn't make it better. What saves your life when you get to hospital is oxygen, it is early, good clinical care from a team who know how to manage you as a patient, and the availability of the right therapeutics. And we're not there yet in therapeutics. We've made huge advances in vaccines. We've made some advances on drugs, but not enough. So when we're talking about the ACT Accelerator or accelerating access, we still have a huge amount to do in developing drugs for the future, for now and for the future, but also in rolling out testing. The testing is now available. The testing is getting cheaper. It's getting to the point even where self-administration of tests access is available. So I think we're going to have to bring all of these tools online, not just vaccination. We've said it, I think I've been saying it too since the beginning, there are very few silver bullets. There's no single solution in an epidemic. There's no one thing. There are no unicorns here. There is just a combination of different things that we do. And if we do each and every one of those things a little better, then we win. And Maria's going to kill me for sports analogies, but
it doesn't. My own sports analogy.
Well, it doesn't matter what you do. It can be in an orchestra, for a philharmonic orchestra. The difference in timing and the difference in skill of all of those different musicians can sound like cacophony. It can sound awful if the performance of one individual or the performance of the totality or the timing of everybody is off. And there's a special moment when everybody aligns and everybody does what they need to do and they time that in a perfect way, and then that's where we get beautiful music. Everything in life at this level, we are performing well now. We're getting vaccines out there. People are really doing a great job individually and complying with the measures. Doctors and nurses have got very good at treating cases. We've now become highly performant. We're performing well in the face of this virus. But if we want to get to the next stage, which is opening up, we're going to have to use every single area we need to look at. My behaviour, my community's behaviour, the effectiveness of the health system, how quickly we're rolling out vaccines, how well we're doing testing. If we improve 2 or 3 or 4% in each of those areas, then we win. What we can't do is say, oh, all we have to do is vaccinate people and this is over. That's not the case. There's much more to do as well. So the testing thing really struck me, because we haven't been speaking enough about that over the last few weeks, because everyone's become very focused on vaccines, which is appropriate, but we need to also continue to focus on testing and on therapeutics.
Thank you, Mike. Maybe before we start closing, we can also share some updates on the strategic preparedness and response plan that we launched last week, and what are the areas of work that this plan is covering. And I know that some parts of it are accelerator, including work on therapeutics, tests, vaccines, but it's much broader than that. So maybe you can share with our
Good. I feel like I'm on a cookery program now, because Maria referred earlier to the weekly epidemiologic update. There it is. It's my Bible. Yeah. I've got my copy this afternoon about 4 o'clock, and I've already marked it up. So it's a really, really good way for any of you out there who fancy yourselves as amateur scientists to read this and see where the world is going every week. It's a great one-stop shop. It's on the web. It's there, available to you all. There's also a weekly operational update which shows what WHO and partners are doing around the world. Some really good examples there, case studies of the difference we're all making in the lives of people downstream. And lastly, this is the Strategic Preparedness and Response Plan for 2021. And I only show it to you because there's 4 very special people on the front, 4 health workers in the front line. And we definitely got our gender balance wrong, because they're all women. And I just remind you that 80% of the health services of the world, the frontline health services, are delivered by women. This is one area where women of the world have been for years delivering the bulk of frontline healthcare around the world, and they continue to do so during COVID. So we celebrate them and their achievements. I would just hope that in the higher levels of health services in future we can reflect that more systematically in terms of health leadership, because again, I think where we've seen more women involved in health governance, we've seen better performance in this response in general. So, but the SBRP is a continuation of last year. It really focuses us as an organisation on our efforts to support our member states and countries. And really it's aimed at stimulating the countries into renewing their annual plan for this year. And we will continue to put the vast majority of our resources into activities at regional and country level. Last year, 90%, 9 out of every $10 that WHO received was implemented through regional and country platform work. The other 10% was used here for global surveillance, for research and innovation, and for many of the other activities at a global level. We've been working with our donor partners over the last week or so to show them that plan. There's also another important document coming out, which is last year's summary. It's a summary of the response to COVID-19 thus far, and it really has a lot of examples in it, country examples. Also on the web, and I don't know if you can post these afterwards, Alex, there's a massive compendium of country case studies, which is a huge number of case studies, which shows exactly how countries themselves have been responding to COVID-19. And there's some wonderful examples in there of community activity, of activity in the health system. And I think we should be collectively a little bit more proud of how we've all responded to this. It's been a huge lift for everyone in the system, from school teachers to nurses to police to grocery workers to seafarers, to everyone's had to adapt and adjust everything they do to stay safe and keep others safe. So while we need to face into another year of COVID, and there are no certainties, the variants introduce uncertainty, other things, we have the hope now of vaccines. We know better what stops this virus. We know better how to treat and save patients' lives. So my view, we look forward to getting as much support as we can for the strategic plan, but also the greater collaboration within the ACT Accelerator. There'll be a plan for that in the coming weeks as well. And we also have the humanitarian response plans at country level. Remember, we had Filippo Grande on last week, and each country, especially those fragile countries, will be issuing humanitarian response plans. We've just had the one for Yemen over the coming weeks. And it's really important, again, that everyone looks to support those countries that have the most conflict and the most fragility, because that's where people are suffering most from COVID and from other diseases. So thank you for the opportunity to show the world that we do have a plan, and that we rely, anything, Maria said it earlier, WHO is a collection. We're not anything other than our member states. Everyone talks about WHO as if it's something separate. WHO is the secretariat of 194 member states around the world. We represent their investment in global solutions, and our job is to serve all people in the world through those ministries of health around the world. And we recognize that it is through them and through science and academia and universities and NGOs and other UN organizations, and mainly through these frontline health workers, that we deliver anything of value. And we celebrate them, and we work those hours and those weekends and those relentless days in order to ensure that they have the tools necessary to stop this virus.
Thank you, Mike. Maria, do you have anything to say as well about the plan for this year?
Yes, I do, because I'm very proud of this plan, because this 2021 plan is an extension of the last year's plan. And the first strategic preparedness and response plan that was published on February 4th, 2020. This was 4 days after the Director General, Dr. Tedros, declared a public health emergency of international concern, raising the highest level of alarm under international law and setting the world a plan to get ready so that we could take steps, to prevent as many infections as we can. And the strategic prepared, and I have my copy too, I have to show you because I mark it up. And I also have the one on WHO's response to COVID-19, because this is also a source of pride, because you see Mike and I, and the DG said it the other day, you see Dr. Tedros, Mike, and I regularly, but we have thousands of staff around the world who are working with ministries that are carrying out this work. It's a good read, so please read it. But in the strategic preparedness and response plan for 2021, Our goal, and it says in here, it's to end the acute phase of the COVID-19 pandemic, to build resilience and readiness for the future. So we are taking this horrible situation that we are in now to make a better future on preparedness for the next infectious threat, because there will be one. And we have several strategic objectives that are in here. One is to suppress transmission. Two is to reduce exposure to this virus by enabling communities to actually take